Good morning.
Go on, Linda, with your little jives. Fan and road surgery, Karen speaking, how can I help? Did you have a lot of sugar?
I love sugar.
So I said to him, you need to stop that.
Have you thought about bariatric surgery?
I'm telling you what, you give me that with it today. Send me now.
So how much do you drink?
Whoa.
And you've tried giving up in the past?
No, never. I enjoy it.
Even though you know it's affecting your chest?
No, I had to cut my food down.
Yeah, but it's not just about proportions, but it's also about what you're eating as well, and also exercising, so going for walks. I mean, where there's a will, there's a way.
I must say that puppy is sounding more attractive.
He can't bend over to do his shoes up. How's he going to bend over to look after a puppy?
Happy New Year. Happy New Year. To you too.
Fan road surgery, how can I help? Do you know what? I just want to have a coffee with some cake and cream.
Cake. She wants some cake.
We can't have cake. Cake is fattening.
Cake and cream.
Cake.
Cake is fattening.
Can I check your weight and then I'll check your blood pressure? Sorry.
I don't have to look at
No, you don't have to. So your weight was that?
2 kilos heavier than yesterday. I knew I shouldn't have eaten that bread today.
The number one thing you can do is lose some weight.
I need that as well. I'm fasting, but it's not
Okay,
doing
yeah.
anything.
So that puts your BMI, your body mass index, at 26.4.
Yeah, I feel in here. Look, here,
Yeah.
here.
So you have put on quite a lot of weight.
Oh, I've got 20k. Look how heavy I am.
All right, he's got to die.
Good. You're doing all right, young man. Good man.
How are you doing?
I'm quite all right. As
Good.
you can imagine, dress sizes.
Well, you've lost a lot of weight, haven't you? Right, so what did they say your weight was? Come on. You trying that?
Sure, yeah, sure. Right, okay, here we go.
84. Yeah.
Better than 86.
Yeah. Well, that's 10 kg in May, June. That's 10 kg in 2 months. That's amazing.
Yeah, it's just a game of willpower from what I see.
Yeah.
Yeah, that's what it is.
That is amazing.
My friends are amazed.
Okay.
My colleagues at work are amazed.
But I mean, you've done incredibly well. Your weight loss is amazing. So.
Yeah, it's been through a very strict diet control. No meat. I do have chicken once a week, fish twice a week, and yeah, absolutely no alcohol. Yes, so I've really cut down on everything.
So you're doing the paleo diet, basically, aren't you?
Yes. and most importantly, average of 6.5 miles every day walking.
Because you walk to the station and
Yes.
back and walk to work
Just now,
and back.
yes,
Yeah.
sweaty and patchy. Yeah. Yes. Yeah, I was reluctant to take the taxi. I said no taxi. I'm gonna make it by half.
Did you get here before the heavens opened?
Yes, I did. Luckily.
Oh, well
yeah.
done you. I'm thrilled you're doing really, really well.
Thank you.
Okay,
I've
good
worked
for
very
you.
hard on it. I have
Huge
really
lifestyle change.
I have taken your advice very seriously and I have worked very hard.
Do you feel
on it.
better?
Yes, a lot. Yes, I am a lot better. Thank you. Thanks to you.
Oh, you're welcome. Well done you there. You're amazing. I'm really pleased. Okay, all right, take care of yourself. Bye-bye.
I'm Dr. Donald. How are you? Hello, Fires. You've got 2 spoons, and they're different sizes. So how is Fires?
Oh, he's really, the poorly feeling.
Oh, since when?
Nah, from day before yesterday.
How did it start?
The sneezing and a sore throat.
Okay.
Yeah, coughing.
Thank you. Thank you for... Oh! Ooh. Hey. So he started sneezing, coughing.
Coughing, yes.
Now, if we take him out of that and we can examine his ear.
They really like it.
I know.
Coming out.
He prefers to be there. That's good. Sorry, I know. Right around the other side. I know, sorry about this. I know. Yes, okay. Nobody smokes. He doesn't live with anybody who smokes.
I am a husband.
Does he okay? You need to get him to stop smoking.
Sorry?
You need to get him to stop smoking. Smoking makes children get 3 times more infections in their ears, nose, throat and chest. Even if your husband always smokes outside the house. Smokes inside the house, it's worse, but smoking just exacerbates infections and can make the child more likely to get infections. It's a common misconception amongst parents that they think if they don't smoke in the house, that the child won't suffer. That's just wrong, wrong, wrong. The products of smoking are on the clothes and on the breath of the smoker. And children are a lot more vulnerable to the effects of passive smoking. The effects are extremely serious. Asthma is much more common. Ear, nose and throat infections. You're more likely to develop conditions like bronchiolitis or pneumonia. And cot death is about 30% more likely in the first year. He's got quite a sore throat, quite a big red, swollen sore throat, and that's why he's not wanting to eat or drink much. In his airways, he has some secretions, but the lungs themselves are fine. So this is really just about his throat. I'm going to give him some medication for a week. I think that will see it off. Now, we have a stop smoking service for Dad, so if you can try and influence him, and they can get really help and also help with medication or nicotine replacement to help him stop. So it's really worthwhile. I know, he has to want to, yeah. That's what you've got to persuade him, yeah. So 5 mils twice a day for a week. He's going to be like this for the next 3 days. Yeah, good. You're very welcome. Yeah, not at all. You're welcome. And hopefully, Fives will settle down. So I think he will.
What's your New Year's resolution?
Oh, I don't make New Year's resolutions.
Because you was breaking that then.
So, like, years ago when I wanted to give up smoking, I gave myself a date and said that's when I'm going to do it.
Right.
And I did.
Mine's to join the gym.
Is it?
Yeah, I'm going to get well fit.
Take a seat.
Well, I went and had one of them Blue Cross medical things. I don't know if you know about it.
Wow, so you've got a thesis written about you. So this is your blood result, was it?
One part on there, so I've got a heart of a 90-year-old.
Got a heart of a 90-year-old.
Also, that I'm grossly overweight. And I know I'm overweight.
So all good news then?
This is the one, the classic, very overweight.
Yep.
My weight is 13 stone 4 pounds. I wouldn't call that grossly overweight, would you? Really?
So it depends what your BMI is. So your BMI is just over 30, which is overweight. It's actually in the obese category.
Really sorry, it's no smoking.
And do you cough much, Maureen?
I do, because I do smoke, I must admit, but
You're still
I only smoke
smoking?
about 15 a day. I'm really pleased about that.
And how much are you smoking at the moment?
It's no more, no less. You know, 8, 10 days. I'm really interested in quitting.
Have you tried giving up before?
Yeah.
What happened?
Everyone bought me bags, so I was going to kill everyone.
How many years have you smoked for?
Since I was 10. I have stopped before.
Yes, yeah.
I was off with 7, yeah.
So you stopped for a good 7 years and then something...
Got married.
You know, we always ask about smoking. Has that changed?
I haven't had a cigarette.
For how long?
3 years.
Okay, well done.
Helen Canavan, please. Hello, Helen. So you're here for your COPD review today? Right. Right, so how's things with your chest?
Yeah, all right. I've had no coughs or nothing. Really good since I've been on that.
All right.
Very good.
So you're taking...
purple inhaler.
The little purple inhaler.
And a green capsule.
Good. Lovely. That's absolutely fine. And do you smoke, Helen?
Yeah, I do.
How many are you smoking?
It's about 10 a day. But that's not, I've gone to roll-ups. I don't smoke cigarettes.
Okay. And any thoughts of giving up?
No, not really. I'm not ready yet. I have cut down, though. Cut down an awful lot.
So how many grams is that, then, if it's roll-ups?
50 grams I smoke a week.
50 grams a week. So it works out at 10 cigarettes a day.
About 10 a day, yeah.
And you've tried giving up in the past?
No, never.
No.
Not interested.
You're not interested?
No, I enjoy it.
Even though you know it's affecting your chest?
Yes, but then it's not since I've been on that.
Feel better with the inhalers?
Yeah, a lot better. Got no coughs.
Well, if you did decide that you wanted to give up, we do have a smoking cessation clinic here. No, I know, I'm not saying you have to do it now. But if you did decide, you just book an appointment with her. She always has available appointments. So. All right. So coughing? Do you cough at all?
No, not at all.
No? No phlegm?
No.
What about breathlessness? Any problems there?
Just get hot flushes.
Do you normally get any chest infections in the winter?
I do, yes.
So we can't tempt you to have the flu vaccine to see if it might help with your winter chest infection.
Well, I don't like it. I've never had it done, so...
So, you've got your little purple and white inhaler.
Look at the state of it.
Gosh. And do you clean it out at all or not?
No, I didn't know you had to clean it out.
That's maybe why it's like that. Yeah, I'll give you another one of these, but you can wash them out. Goodness me, you've got half your medication in there.
I'm losing weight, I tell you that, because my belt.
Yeah.
I've gone up one notch.
Yeah. Well, you need to continue doing that. And obviously, the best ways of doing that is through your diet and your lifestyle. If I'm being honest, I think what you need to focus on and what your take-home point from I think all of this is your weight.
Yeah.
Okay. Because you'll be surprised how much of an improvement on your overall health, losing some weight and bringing that BMI number down, your proportion of your weight to your height, bringing that number down will have on your overall sense of well-being. But also your risk of having things like heart attacks and strokes.
I don't drink. I mean, I do have a drink.
Yeah.
But I never drink because I drive. I never drink two pints.
So I think what you need to do is focus on your exercise because the rest of your checks were okay, but it did show that you are overweight. So losing weight and exercising, I think, is going to be the key here.
Well, as I said, I had cut my food down.
Yeah, but it's not just about proportions, but it's also about what you're eating as well, and also exercising. So going for walks. It doesn't have to be.
I can't walk very far. I've got arthritis, both my knees and both my ankles.
It doesn't stop you swimming. I mean, where there's a will, there's a way with these things, and I think it's easy to blame lack of exercise on arthritis, but there are ways around it of low-impact exercises that won't involve you running or putting a lot of stress through your joints that will still be good for your heart. But the take-home message from today, I think, is that you need to work on your weight.
When I started doing sit-ups and touch my toes and for 5 or 10 minutes in the morning, that sort of thing. And, but I mean, I stopped it for a while.
Yeah. Well, I think you need to get back on with that. Yeah. Okay, so. Yeah, I think exercising will help. All right then, we'll see you in about a month.
I have to sit down because I keep losing my trousers. You keep losing your trousers? You're losing weight then? Yeah, look.
That's good. I wish I was so good.
It's not coming off in the right places. I think it's on my legs and...
Mine always comes off my legs and my bum. Lastly will go on my boobs.
Yeah, I'm all over the place. Come and take a seat.
God, I've been walking, brushing on my feet.
Oh, that's good.
Whew.
How you doing?
I'm not too bad,
Yeah, good.
considering.
Considering what, advanced years? No, you're doing well. I mean, it's hard to believe, when I look at you, you're meant to be 59.
Yeah, I'll be 60 in 4 months' time.
Yeah, exactly. So you look about 30.
Oh, thank you very much. I'll say that to my husband.
Yeah, tell him. He must be keeping you young somehow.
You send me a letter.
Oh, to come in for your rooms. Yeah. So how are things going along that line?
It's been all right. Only I got some pain sometimes in my fingers,
Little
pain
bit.
and needle, and in my knee because I going up and down the stairs.
Yeah. Although I think your last lot of bloods were pretty good, weren't they?
Yeah, I had it the last week or the week before, I think.
Yeah, so, for instance, when you look at your inflammatory markers, if your rheumatoid was really playing up, you'd expect it to be going through the roof. But actually, it's not. It's really low.
Then my blood pressure is down now.
Yeah, pretty good. Yeah.
So to me, it's very good. I say, yeah, because I stress-free now.
It's stress-free. Why is that?
No, because I used to do a team leading job.
Yeah.
I was too much, so I just give up.
You gave up? We are seeing more and more patients who are more and more stressed. We can suffer from tremor, sweating, palpitations, stomach cramps, anger and irritability. So what are you doing now instead?
I just do a normal cleaning.
Normal, okay.
Normal cleaning.
And not in charge of anybody else?
No. Just do what I have to do and go home.
Ah, what a nice idea.
I stress somebody else.
Yeah, you...
Somebody else take that stress.
Oh, my goodness me. People can help their friends or colleagues who are under stress just by being there. I think having support or a support network is really essential in today's life. Being able to talk to somebody about their problems and the things that are causing them stress is really essential. Thank you for coming in.
That's okay. So I don't know when you're going to see me, probably after my 60.
Yes. What are you doing for it?
I'm going to Seychelles to celebrate.
Are you?
Yeah, most of the family is over there. So we just go and celebrate.
Excellent.
Yeah.
You enjoy yourself?
Yeah, my sister's coming as well, so my nephew, they live over here coming with me, so that would be, yeah.
Good on you.
Thank you very much.
Good to see you. Take care. Well done. Bye. How are you?
The severity of the dizziness
Yeah.
has gone, the severity is a lot less.
Good. It reduced.
Yeah.
Good.
But I ended up on the floor the other night,
Yeah.
And you didn't injure yourself then?
Fell on my side.
Did you? Okay. Okay. And did you have a bruise or a cut or anything there? No. And did you think about having this manoeuvre I was describing done to send the dizziness away completely, or do you think it's settling by itself?
Would it send it away completely?
Well, that's the idea. There's no guarantees.
Yeah,
There's no guarantees with this, but we could do it.
I'd rather have the manoeuvre
Yeah.
and not take more tablets.
Would you? Okay,
Yeah.
okay. So I'm quite happy to do it. Do you think you'll be comfortable lying flat?
Yeah, once I'm flat, back might twinge through.
A little, yeah. So that's what we'll do, and we'll see how you get on.
Sorry, I'm just doing my exercises.
My old dear, she's thinking of getting an exercise machine. Now, is exercise machine any good for me? Yeah.
Exercise is good for everyone, including
the old checkup, won't it?
Do you do any exercise?
Not an awful lot.
Yeah, what work do you do?
Admin.
Okay.
Do you do any regular exercise?
Fishing season starts this week, so I can carry a big bag and I can walk up to 3 or 4 miles in a day.
Yeah.
So, I don't go to the gym or anything.
How are you doing with the gym and everything?
Yeah, not too bad.
I need to get back into shape. After having a baby, it is so hard.
Do you know walking football?
No, I've not.
No? It is what it says it is. It's for more mature people. Old gits like me.
So I'm going to keep you in this position now for about 30 seconds or so. Have you ever been to a physiotherapist to get back exercises?
They wouldn't do it because of the pain it was causing me.
Oh, really? Mm. Well, the way of getting rid of your back pain is through some exercises, which you need to do on a daily basis.
Yeah.
They say that exercise is the best anti-inflammatory. If you're doing exercises on a regular basis, you'll have less back pain.
So if I had a puppy to walk every day...
Take no notice, he's not having a puppy.
Oh, that's a bit cruel.
Yeah, but if I get a doctor's note, so I need it.
Yes, this is what we call social prescribing.
Yeah.
If I prescribe a puppy, then a puppy...
He lives with you.
Only a small puppy, much.
Good. OK, so bring yourself right round again. Good.
Onto my back.
Yeah, just as you were. Just reverse it at your own speed. Well done. That's right. Good. Up you come. Nice and slowly. Well done.
Right.
Well done.
What's the matter? You've gone dizzy?
Yeah, that's what you can often find. But...
That's as much exercise I do in a week.
Well, I'd like to see you do more. I think that would... Yeah, I think it would be really helpful. I must say that puppy is sounding more attractive.
Dr. O'Donnell, come on now. He can't bend over to do his shoes up. How's he going to bend over to look after a puppy?
Usually, when people get pets, they become more active. Quite a lot of evidence about the health benefits of having pets. I'm just thinking about you and what would be for your health benefit.
Yeah.
So, a dog you can manage.
Only a little
Yeah.
Jack Russell, you know.
A nice friendly dog that you can manage.
As long as I can train it to slap at the
Yeah,
wives.
good. Wait for about a week until you see the full effects of this. Well done. You did much better than I thought you would do.
Thank you.
Hi.
Hi, I've got an appointment with a doctor.
I can't believe you just put that drink there. I really want a Coca-Cola right now. I'm gonna have to ask my partner to bring me one.
Mr. Malik? Hello.
Hello.
Thanks for waiting. My name is Dr.
Hello.
Bajwala. How can I help you, Mr. Malik?
Yes, I've been here last month.
Yes.
With some other doctor. I'm drinking too much.
Yes.
Yeah. And I actually can't go to the work, nothing.
When you say you have a drink problem, what do you mean by that?
I'm drinking every day.
All right, so how much do you drink?
Whoa.
How do you quantify your drink?
I'm drinking a cider.
Yes.
Yes. You know the big bottle? I don't know
Yes,
if you
3
know.
liter, 3 liter.
3 liter one, 7.5%.
Yes. Yes.
So it's like 1.5 a day.
Yes.
I'm not getting myself drunk. I'm just, I just have to drink it.
Yeah, if you don't drink, what happens?
I got headache,
Shaking
shaking hands. I'm vomiting in the morning with the
Yes.
phlegm and everything.
So how long you been drinking this heavy?
This
This too much.
This is not heavy. I was drinking heavier.
Do you drink any alcohol at all?
Today?
No, anytime.
Anytime. Sometimes, yes, beer.
Alcohol, do you drink any?
Yeah.
Yeah? How much in a week? Be honest.
How much were you drinking, alcohol-wise?
Probably 4 tins, 4 pints a day, maybe.
It's quite a bit, isn't it?
Yeah.
Were you doing that every day?
Most days.
Yeah, okay.
So how much would you normally drink when you're out?
3 beers, a couple of wines, 2 or 3 wines. For a party, maybe.
So, how many parties have you been to?
Yeah, no, not too much. But before.
Yeah. So not every day.
I was there for lunch today.
Right. Okay.
A beer and 2 wines.
Okay.
How many parties last year?
Last
1,
year.
5, 10?
1, 2.
Okay, so that's fine.
I can see that you have definitely got alcohol problem. You're drinking way excessively than what you should be because you're saying that you're drinking mainly just to feel normal. Yeah? If you don't drink, you will have aches and most likely you might end up having a fits which can kill you.
Yeah.
How about the money? How are you doing financially if you're not working?
She's working. I'm taking money from her.
All right.
The thing is, I've been supplying it for so long now, and the thing is, in my head now, if I don't give him the money, he's going to end up in hospital again.
Yes, I can understand.
And
Yes.
it's getting really bad.
And what you need to do is obviously to get into alcohol service again. You need to get detoxed. Once you get detoxed, you engage yourself into AA, Alcohol Anonymous. I will obviously write to them as well, but they expect the patient to come by themselves. Then they know that the patient actually wants to do it. If he doesn't go, you let us know. You come back here. Yeah? Sure?
Yeah, I will.
We know that the people who are drinking alcohol, they don't eat very well, and that's why we prescribe vitamins. Yeah? So I'll do a prescription for that.
Okay.
You need to have a blood test, especially with your liver function. Yeah? Okay. All right.
Maybe I'm gonna.
Okay, thank you.
Yeah?
Thank you very much.
Okay then.
Thank you, bye-bye.
I understand you have a smoking nurse here?
Yes, we do.
Could I book an appointment to see her?
Okay.
They put £1.20 on a packet of cigarettes. That now makes it over £7 a day. That I thought, no, Kev, I'm sorry, mate, you're a fool. You've got to stop this.
Yeah, I know.
You know what it's doing to your health. You know
Yes,
it's
that's
just
true.
ridiculous, my love. It's silly.
Yeah. That's a good decision.
I just don't want to think about smoking at the moment. Thank you, best
Take
wishes. So
care,
that's
sir.
this Wednesday.
This Wednesday, 10:45. Do you know when to
Terrific.
see you?
Thank you
Okay?
very much.
Okay, bye-bye.
How are you today?
I come in last Wednesday. My throat was really sore.
Yes.
And closing up. The swelling's gone a bit, but the infection, everything's still there.
Yes.
I've got a lot of burning all down here. I'm really achy and struggling to eat. I'm gargling salt water every hour.
Yes.
And it is just...
When did this all start, John?
Just over a week ago Sunday.
Bro, any cough?
Yes, the cough. The cough's just been because I've got a normal sort of smoker's cough. I'm not a heavy smoker.
Okay.
I'm in the process of trying to wean myself off.
Good.
The cough has been getting worse. I'm bringing a bit more stuff up.
What colour's the mucus now?
There could be a little bit of green in it.
Any wheezing?
Yeah, a bit, but I have been diagnosed with asthma recently. Well, COPD, but she said at the moment it's more like an asthma.
Okay.
But I still walk, and I walk at a brisk pace. And when I was first diagnosed, I got a pedometer to see how far I was walking. I was doing 13 miles.
Wow, okay, a day?
A day.
Very good. That's better than me.
I do overtake some joggers.
I'd probably be the person you'd be overtaking, to be honest.
Even though I smoke.
In terms of the smoking, how much do you smoke at the moment?
I mean, I reckon at the maximum, it's about 7 or 8 a day.
Have you had help from our smoking cessation clinic? So getting help from the smoking cessation clinic has proven to be far more effective than trying to do it by yourself.
Yeah.
And with your history of COPD with the lung disorder, is massively
I
important.
know, it comes to a point in your life where you just realise you can't do it anymore.
Good man. But it sounds like you're absolutely on the right track, Jonathan. So you want to change, which is the biggest hurdle, which is good. So just pop your finger in there. Huh? Stopping smoking is one of the best things a person can do to improve their health. After a person stops smoking, within 3 days, they can feel their breathing becomes easier. From weeks to months after stopping smoking, they'll have more energy, you'll feel less tired, there's improved fertility and sexual function. After a year, the risk of heart disease is half that of a person who's continuing to smoke.
Sorry.
That's okay.
See, it's just like that. It's dirty little bits.
Okay, grab a seat. Okay, Jonathan, we definitely need to continue your antibiotics. You only had 7 days of those antibiotics. Usually for the course, it's a 10-day course. Glad you came in. Let's get it better.
Okay, thank
All right,
you very
no trouble.
much,
Lovely to
Doctor.
meet you, Jonathan.
One sugar for me, Ryan. I've cut down. Dr. Nanda told me I was diabetic. Wait today happen, so just thank you. You're a star. Yeah, thank you.
Hi, Amrit. Come in. Come and take a seat. Your mum, yeah? Yes. Okay, and this is Amrit. Yes. How can I help?
Now, Amrit started off by having like a few little pimples on the side of his head.
Oh, yeah.
But it's actually then it got septic and the burst and then become blotches.
Okay. So when did this start?
In about a week.
Okay, so did it start with one pimple or?
Yes. It started with this one.
Okay.
And then, can you see how it spread? And there's some hair. Now it's getting really it started scabby.
Okay.
And it started there. It sort of gets a bit sore in the evening and on this side.
Yeah.
So where
Are
it's
they
like-
itchy? Yeah. They're itching.
And I can see
And
actually
they're
it's quite
yellow
nice.
too. Is there yellow pus coming out?
Yeah.
Like, is it clear or yellow, Mum? Have you seen?
And it's coming on this side as well, if you can have it.
Yeah, I'll pop a pair of gloves and we'll have a feel now.
It's itching.
Yeah, it's itching. Has anyone else in the house got a rash at the moment? And do we know what caused this? Did you remember being bitten by an insect? Anything at all? Okay.
She thought it was eczema, and she showed me extra things like it could go all over your body.
I mean, if we left it, it potentially could go to bigger parts of your scalp, so...
So we need to, and I Googled it, so
Yeah.
I was saying to him, we must cut out your sugar. But he does eat a lot of chocolate.
Do you? So do you have a lot of sugar? On average, kids in the UK are consuming 3 times more sugar than they should be doing. Sugar can cause dangerous unseen fat deposits in children's bodies, especially around the vital organs. And this can start at a very young age. So we do encourage parents to cut back on a children's sugar intake.
I love sugar.
So I said to him, you need to stop that.
Yeah, I'm addicted to sugar as well. I've seen a rash similar to this, actually.
Okay.
It tends to be bacterial. So the normal bacteria in our skin is called Staph aureus, and that produces that clear yellow kind of pus. Let's have a look at this.
It's like a number of allergies and things that are going within. But can you see where it's like now spreading?
Yes. Normally, we would give a topical or an oral, basically, antibiotic. I think because this is actually spreading, we're going to have to go for the oral antibiotic or flucloxacillin. Is he allergic to anything at all? Penicillin, anything?
No,
He's had amoxicillin.
Yeah, he's had that.
With the creams and things, try to leave it dry, but if it's itching, obviously don't try to put any oils or things on it. So what are these toys you've got?
These are from the Kinder Eggs, but I don't eat them anymore.
Because they've got a lot of sugar.
I've got only these 3. They're from the cartoons.
Really? That's the antibiotic. 1 spoon 4 times a day.
Okay, lovely, thank you.
All right then, nice to meet you.
Get
Take care. Oh, don't forget your green one. Here you
Come
go.
on, you. Such a cheeky. God, you're such a rascal.
How are you? Just take a seat. Hi, how are you?
Jacqueline.
Hello. Very good. Nice to see you.
And you.
Good. So, what can I do for you today?
I believe we're here for results of blood tests.
Results. Okay, so let's just have a look. You had a kidney function test done on Friday, and that was very good. But your sodium is low. Sodium is something that's in your blood. Sodium chloride is salt. This is probably the lowest it's been at 126.
My dad does drink alcohol. Would that be a cause?
It could, yeah. What do you drink? Is it beer you drink? Yeah.
Wheat lager.
Yeah, And how much of it would you drink in a day?
It used to be about 6 when I was watching the football, but
Yeah.
for the last week or so it's been maybe just 2 or 3.
2 or 3. And is that what it's like normally, 2 or 3 a day?
No, it used to be twice that.
Twice that, 6, yeah. Well, I mean, low-risk drinking would be something like a maximum of 1.5 pints a day. So it probably would be a good thing to cut it down, not just from 6 to 3, but from 3 to 1.5.
I don't believe that it's only for 2 or 3 some days. That's my opinion.
What do you believe is the average?
I think that he probably drinks between 3 and 6, depending on the day and
Yeah.
who he's had round or what he's been doing.
Yeah.
And my dad has drunk for a long time. I can't just tell him to stop.
No, and I wouldn't have him stop. I wouldn't have him stop. It's just that drinking more really than 1.5 pints in a day is going to expose you to risks in terms of your liver, your stomach, and killing liver and brain cells. So it's good to just be a low-risk drinker and manage your risks.
Not trying to be a smart ass, but I've always known the risks.
Yeah. It's up to you to decide what level of risk you're happy with. But the snag is, as you get older, those risks turn into reality. And that's the problem. Then the chance of them happening climbs up to, 70, 80, 90%. I mean, that's nearly a guarantee that they're going to happen. Now, not all of them, but none of them. So it would just make sense to sensibly cut down as much as you can. If you need help with that, there is help available. So that's a urine test and a blood test. If you could make an appointment.
Next week?
Yeah,
Yeah.
in about a week's time.
Brilliant.
We'll see. Good?
Thank you
Yeah, nice
so
to see you,
much.
yes. Yeah,
Have
nice-
a lovely
yeah,
day.
Yeah, and you.
Take care.
Bye.
There you go, go steady. See you.
Yes, bye now.
About you, Kearney.
What?
Any New Year's resolution?
I'm gonna drive.
You're going to drive?
That's a good one.
Yeah, that is a good one, because that's...
By April, I'll be driving.
That's achievable.
Yeah, that is.
Not like me.
No, neither. I failed my test 3 times before I passed.
Oh my God, I've got mine booked for the 7th. February the 7th, mine's booked.
What, your driving test?
Yeah,
Oh my God.
I'm proper scared. Yeah, I'm proper scared.
How are you coping with everything?
Oh, the legs are killing me.
They are swollen, aren't they? Like a little, yeah. On the feet, yeah.
And then when I wake up in the morning, they're still swollen.
On the left side?
Same. Nothing moves. My whole body doesn't want to move. And I see it's sore when you press that.
Yeah, yeah.
Everything feels sore on the back. When I lay down to go to sleep, and I'm like literally at rest.
Okay.
The back of my shin hurts. I've got a chair that can pick my legs up, and that kills me because the back again is touching.
And you've got very dry skin. Are you applying any creams at all?
I can't do it, can I? I can't reach because I'm arthritic up here. I can't do anything. Nothing at all.
So there are many reasons why people end up with swelling in the legs. One of the main reasons is any internal system failure like liver failure or kidney failure.
Or heart failure.
Heart failure. So obesity itself, you'll have sluggish circulation. And for that, we tend to advise, of course, leg elevation and stockings and everything to help.
Anything just to stop this.
That's right.
Heaviness.
Have you ever been tried on stockings at all?
Never.
Never. To try that and see whether that would help with your leg swelling.
I'm always out of breath. You know, I get as far as my door to open it to somebody.
Yeah.
And I feel like I've run a marathon.
I don't eat a lot of rubbish. I eat this English roast beef Yorkshire pudding and steak pie.
What food are you making at home? What kind of things?
If you know about the Asian food, the roti and salan.
And how many rotis are you having?
No more than 1.5.
I do like about lunchtime about 3 digestive biscuits and a couple of choc biscuits. Not chocolate biscuits, but with chocolate in them.
Okay.
With a Kit Kat.
I thought, oh, I fancy a pasty.
Okay.
I took it home, I put it in the microwave and had some chips.
What sort of bread do you eat? White bread or?
Yeah, white bread.
Okay, so you need to stop the white bread and eat brown bread instead.
Right. I would steer clear of sugar.
From 3 sugars in my tea, I'm only having 1 now.
Well, 1 is better than 3.
I just like sweet things, so.
Well, don't we all? I love sweet things.
I finally get you in the room.
You want to take a blood this morning?
No blood. We done it already, didn't we? So I'm just gonna check your blood pressure and then I'll just make sure you're all right.
My sugar's not back yet.
They're back. They're better than what they were, but they're still a little bit high. Do you drink any alcohol?
No.
Smoke?
No.
Are you sure?
Yes.
I'm joking. And in terms of dietary, how are you doing?
I think I eat a lot of bad things because I send the children out every other day to get me a sponge cake, jam sponge cake, which is not good for my diabetic.
Yeah, all the sugar in that and the jam. Okay, so we need to stop with the sponge cakes. Is it a whole sponge cake you're eating or just a slice?
Just a slice.
Every day?
Yeah.
Oh gosh, no. No. Right. And then what about carbohydrates?
I eat rice.
Yeah. A lot of rice?
Not a lot.
No. Okay.
Rice.
And fruits? Do you eat a lot of fruits, vegetables?
No, I do eat a lot of fruit. I eat a lot of mangoes.
Yeah?
I will eat 2-3 mangoes a day, sit down and eat 2-3 mangoes.
All in one go?
Yes.
Oh my word. Right, so mangoes, fruits are fine.
Yeah.
But too much fruit in one go, again, a lot of sugar, because fruits contain a lot of sugar. Yeah? So try to space it out. Any questions? Any worries? Any concerns?
Yeah, I want to. Some days I'm feeling up, some days I'm feeling
a bit down. Yeah. Is it lifestyle, or do you do things at home? You know, do you have any hobbies or anything like that?
I was to go to the gym, but I stopped now.
Go to the gym?
Yeah.
Wow. Okay, go. Join back on there, because exercise helps. Yeah. It really helps. When you're feeling low, it helps. The body releases things that it needs to get rid of. No, don't sprint on the treadmill. But no, exercise is really good. But yeah, I mean, if you're feeling really down and it's getting to the point where you feel like you need to speak to someone, that's why we're here. Yeah? And I'm always about as well. I can always help.
Yeah.
Lovely. All right, good to see you. Let me get the door. Take care. All right, bye-bye now.
I eat and I feel like I'm full up with every little meal I have. I mean, I eat in the morning about 8.
Have you thought about bariatric surgery?
I'm telling you what, you give me that with it today. Send me now. I'd have anything. Do you know what I'd like? To be like her again. Because doctor, for years, I was a dancer, a singer on stage. I was always slim.
It's worthwhile touch basing that if you're interested. I can see
100%. I just want to be me again and be able to walk up the street.
Yeah. Realistically, we need to look at that now.
Brilliant.
Bariatric surgery has had its fair share of controversies. When patients are obese, there's a perception it's a self-inflicted condition. What one needs to remember is, although the bariatric surgery costs money, in terms of thousands of pounds. For example, a gastric bypass can cost up to £8,000. It reduces all the multiple long-term complications, which would take much more from the NHS in terms of the spend. Is that okay?
Yeah, that's 100%.
Let's do it.
You're a darling. Lovely. You're an angel.
All the best. Good to see you today.
Yeah, it's good to see you too. You don't look a day older.
Day older.
But I'm 2 stone heavier.
All right.
So that's my older, isn't it?
Yeah.
Thank you, doctor.
All the best. Take care.
What do you want? Coffee. I don't drink caffeine, full stop now.
Oh, now you have your own tea bags.
I gave it up, I did. It's hard work.
Do you not miss it?
No.
Really?
No. It's been easily 9 months.
Wow. Good girl.
Bruno Bassano. Hello.
Hello. I never see you.
Come in and take us. Oh, well, I've been here 9 years.
I know. I'm sorry. I'm registered with you now.
No, you registered with Dr. Bolger.
She goes like, she's very good. She's tough as cookie. You're tough
Well, it.
I lost 1.5 stone. I've been in very well for the last 4 or 5 months. My cholesterol got down as well. My blood pressure's got down. My feet is fine.
The only thing that isn't fine is your diabetes.
Well, I have to work on it.
Really not good. It's got worse.
Is it?
Mm.
What else I should do?
Well, that's the question. Do you have a sweet tooth? Do you eat lots of sweets?
Sometimes, yeah, Yorkie, that's all I eat. Well, I eat 1 bar of chocolate Yorkie almost every day. I like that.
Okay.
I'm a sucker for that.
Right. Once a week?
Not every day.
Not every day?
Yeah, okay, then, because I go to work and I don't eat because I'm a bus driver. I work in the airport and I don't eat at all, especially in the afternoon, when it's afternoon shift. Sometimes I just take 1 Yorkie bar and a couple of bottles of water. That's all I do. I don't eat nothing. I think that's could make my diabetes go up. Chocolate?
Chocolate is terrible stuff for people who have diabetes. Yeah.
I have to.
The problem with chocolate is it's not only has it got sugar in it, it's got lots of fat in it as well.
Yeah.
So on both counts, it's really not good. And the fat slows the sugar release, which is not good either.
Sometimes I'm going to not put my hands on the fire. Now and again, I have a pint of lager.
That is allowed.
Oh, bloody hell.
Life's too short not to have a pint of lager.
But the chocolate, I do eat it.
Yeah, the chocolate we have to stop.
Okay.
And what we'll do is we'll check you again in 3 months' time and see how you're doing.
Yeah, no, I will cut that down.
Okay, science.
Dr. Howland,
All right,
nice to see you.
take care.
Nice lady. I'll
Bye-bye.
see you next time.
All right. Bye, Mr. Bassano. I shall tell Dr. Bolger it's easier to see the Pope. Oh, dear.
Thank you. See you around. Thank you. So for my New Year's resolution, I've decided I'm going to try and get some more sleep.
Nice to see you. Yeah.
Thank you. Thank you.
Yeah, you take care, Mr. Said. Yeah. Bye now. I make resolutions all the time, so I don't wait for January the 1st. So I probably have about 150 or 200 resolutions every year.
Cheers.
Nice to see you.
Cheers. Bye-bye.
I need to look at having a much healthier diet in 2017.
Take care. Good luck with everything.
Thank you.
Bye. My own New Year's resolution is to definitely cut back on my sugar intake and to maintain my regular daily exercise.
Bye-bye. We're friends now, excellent. My New Year's resolution is to focus more on my sports and exercise, especially football, so hopefully one day I can sign for Liverpool Football Club.
All right then.
Better safe than sorry.
Okay then, don't forget your Skittles, unless you're leaving them for me.
This year, I want to ensure that my life is full of more singing, more fun and more laughter.